Have you ever tried to stand up in the morning, only to feel like your knees have turned to stone? Or lifted your arm and felt a sharp, inexplicable pain shoot through your shoulder? What if I told you that millions of people every single day are quietly battling a hidden enemy, one that doesn't just cause discomfort, but slowly chips away at their ability to move, live, and simply be? This is the silent world of musculoskeletal disorders. A world that, once you step into it, changes everything. Our bodies are beautifully complex machines. Every muscle, every bone, every joint is designed to work in perfect harmony. But when something goes wrong in this system, the effects can be devastating. Musculoskeletal disorders refer to a wide range of conditions that affect the muscles, bones, and joints, the very foundation of how we move, stand, and function. These disorders often bring with them chronic pain, joint swelling, limited range of motion, muscle weakness, or even visible deformities in the bones. What makes this even more heartbreaking is that many people don't take these signs seriously. Not until it's too late. These conditions aren't just inconvenient, they can be life-altering. Imagine being a parent who can't lift their child without searing back pain, or a professional pianist whose fingers won't bend the way they used to. That's the reality for countless individuals, young and old alike. One of the most difficult parts about living with musculoskeletal issues is how quiet the suffering can be. It's not always visible to others, and it's easy to dismiss joint stiffness or muscle fatigue as just getting older or just a bad day. But over time, these minor symptoms can evolve into permanent damage, disability, and irreversible complications. These disorders fall into two main categories. The first is traumatic musculoskeletal injuries, caused by things like sports accidents, traffic collisions, or workplace injuries. The second, and often more complex group, is non-traumatic disorders. These develop gradually over time or are linked to underlying medical conditions. Among the non-traumatic conditions are autoimmune diseases like rheumatoid arthritis and lupus, which cause the body to attack its own joints and tissues. There's also gout, a condition where sharp crystals build up in the joints and cause sudden, excruciating pain. Osteoarthritis, on the other hand, is the slow erosion of cartilage, the cushion between bones, leading to stiffness and pain that worsens over time. Then there's osteoporosis, where bones become weak and brittle, often without any warning until a fracture occurs. Other conditions include tendinitis, bursitis, degenerative spine disease, infections that inflame the joints, and even cancers that spread to the bone. Each of these disorders has its own fingerprint, its own story. But they all steal the same thing: freedom. Here's what I've learned, both from personal experience and from people I've spoken to who live with these conditions every day. Pain doesn't just exist in the body. It settles into the spirit. It limits joy, steals independence. But here's the lesson: early awareness changes everything. The body whispers before it screams. If we listen, if we act when the stiffness begins, when the twinge of pain returns, when motion isn't what it used to be, we can often slow the progression, relieve the pain, and regain control. So what helps? Movement. Gentle, consistent movement. Low-impact exercises like walking, swimming, or stretching can work wonders. Staying active keeps joints lubricated and muscles strong. It's not always easy, especially when you're in pain, but the more you move, the better your body responds. Also important is communication. Talking to your doctor, asking questions, getting regular checkups. Too many people rely on old prescriptions or outdated advice. They skip follow-ups and self-medicate, assuming it's just something they have to live with. But ignoring symptoms can mean missing the critical golden window, where treatment is most effective. For many, treatment might include physical therapy, anti-inflammatory medications, joint support, or even small lifestyle changes like adjusting diet and sleep. In severe cases, surgery may be required, but more often, these conditions can be managed without going under the knife. The important thing is to act. Take your pain seriously. Take your body seriously. I've seen people who couldn't walk more than a few steps reclaim their strength. I've seen parents get back on the floor to play with their children. I've seen those who once feared every step now run, dance, and live again. Musculoskeletal disorders may slow us down, but they don't have to stop us. So the next time your body speaks to you through pain, stiffness, or weakness, don't ignore it. Don't push through blindly. Listen, learn, enact. Because movement is life. And everyone deserves the chance to live freely, in a body that supports their dreams, not limits them. Have you ever wondered why some people suddenly struggle to walk after a fall, while others wake up one morning unable to move a finger, with no obvious reason why? Musculoskeletal disorders don't come in just one form. They wear many faces, creep into people's lives in countless ways, and leave lasting imprints on bodies and spirits alike. Some are the result of a sudden blow, a tackle on the field, a crash on the road, or simply a misstep at work. Others come quietly, slowly, over months or years, stealing movement and causing pain without ever drawing attention, until it's too late. Understanding the different types of musculoskeletal disorders is like decoding a hidden language your body speaks when something is wrong. And knowing how to listen could change your life. Let's break them down into two major groups: traumatic and non-traumatic disorders. The first group includes injuries we can often trace back to a specific event. These are the broken bones, torn ligaments, and strained muscles that come from accidents, whether it's falling during a soccer match, crashing your car, getting hurt on the job, or slipping at home. We call these trauma-related musculoskeletal disorders. They're sudden, painful, and hard to ignore. The body reacts immediately: swelling, bruising, sharp pain. And while they're often treatable, they can leave lasting scars, both physically and emotionally. I've seen athletes break down not just because they're hurt, but because in that one instant, everything they've trained for feels at risk. I've also seen ordinary people struggle to return to everyday life after an accident left them unable to work or move the way they used to. But what if the pain doesn't come from a single moment? That's where the second group comes in: the non-traumatic musculoskeletal disorders. These are more complex. They're sneaky. They build up over time, sometimes from within, sometimes due to wear and tear. And they include some of the most misunderstood and dangerous conditions out there. Let's start with systemic diseases. These are autoimmune conditions where the body's immune system goes rogue and starts attacking its own tissues. Think rheumatoid arthritis, where joints become inflamed, painful, and permanently damaged if left untreated. Or systemic lupus erythematosus, a disease that can affect not just joints but skin, organs, and even blood vessels. Then there's polymyositis and dermatomyositis, which cause progressive muscle weakness and inflammation. These aren't just joint problems, they are full-body battles. Then we have spinal diseases. For example, ankylosing spondylitis, a form of arthritis that primarily affects the spine and can lead to fusion of vertebrae. Imagine waking up one day and realizing your back no longer bends. Or degenerative spine disease, like spinal osteoarthritis, which wears down the discs and joints in your back, causing chronic stiffness and pain. Can make walking, sitting, or even standing feel unbearable. Another category is crystal-induced arthritis, like gout. This one has an especially cruel reputation. It strikes suddenly, often at night, causing red, hot, swollen joints, usually the big toe. The culprit: sharp crystals made of uric acid building up inside the joint, like tiny daggers. It's intense. It's immobilizing. And without treatment, it can return again and again, damaging joints permanently. Next comes a group many people overlook: infections of the musculoskeletal system. Conditions like bacterial septic arthritis, tuberculosis-related arthritis, or joint inflammation from viruses, fungi, or even parasites. These aren't just rare tropical diseases. They can happen to anyone, especially those with weakened immune systems or underlying health issues. The challenge: they often masquerade as common joint pain. But left untreated, they can destroy joints in days. We also need to talk about non-inflammatory bone and joint disorders. These include things like osteoporosis, where bones become brittle and fragile, so fragile that something as simple as a sneeze or a cough can cause a fracture. Or osteoarthritis, the most common form of arthritis, where cartilage, the cushion between your bones, gradually wears away. Doesn't just hurt, can lock your joints, grind bones together, and steal your freedom of movement. Avascular necrosis, another condition in this group, happens when blood supply to the bone is disrupted, leading to bone death. It's silent at first, but once pain appears, damage is already underway. Then, there are disorders of the soft tissues around joints, conditions like tendinitis, tenosynovitis, and bursitis. These affect the structures that cushion and support our joints. Even simple movements, typing, climbing stairs, lifting a grocery bag, can become excruciating. These issues often seem minor at first, but they can drag on for months, even years, without proper care. And finally, the scariest of them all, bone tumors. Some are benign and harmless, but others, like primary bone cancer or bone metastases from cancers elsewhere in the body, are life-threatening. These are often discovered late, after pain and swelling have set in, and require urgent, aggressive treatment. So, what's the lesson in all of this? Not all musculoskeletal pain is created equal. Some types come on suddenly, others build over time. Some are treatable, even curable. Others must be managed for life. But every one of them deserves to be taken seriously. Your pain has a name. Your stiffness has a cause. And your discomfort isn't just part of getting older. If there's one thing I've learned, it's this. The earlier you understand what's happening in your body, the better your chances of living a full, active, and joyful life. Don't wait. Don't guess. Listen to your body. Learn the signs. And get the help you deserve. Because knowledge is not just power, it's freedom. And in the battle for your health, freedom is everything. Have you ever woken up in the morning and felt like your body just doesn't want to move? Your knees are stiff. Your fingers won't bend. Your back feels like it belongs to someone twice your age. And you wonder, what's happening to me? You're not alone. That stiffness, especially in the morning or after sitting for too long, is more than just an annoyance. It's your body sending a signal, a message that something's changing. Or maybe something's missing. Let's talk about joint stiffness, why it happens, what it means, and how you can take control before it takes control of you. For many people, the answer lies in something as simple and as inevitable as aging. As we get older, the cartilage in our joints, the smooth, rubbery tissue that cushions our bones, starts to dry out and thin. It loses its elasticity. What was once a flexible, protective layer becomes fragile and rough. And that's just the beginning. Inside each joint is a lubricant called synovial fluid. Think of it as the oil in an engine, keeping everything running smoothly. But with age, your body makes less of it. The result? Movement becomes less fluid. Your joints feel like rusty hinges instead of well-oiled gears. And mornings. Oh, those cold, quiet mornings can be the worst. You get out of bed, and for a few moments or maybe longer, your body simply doesn't cooperate. Knees crack, hips protest, fingers curl tightly and refuse to let go. It's frustrating, sometimes even frightening. But here's the surprising truth. Staying still makes it worse. You'd think rest would help, that avoiding movement would give your joints time to recover. But in many cases, the opposite is true. When you don't move, your joints don't get the fluid circulation they need. The synovial fluid sits still. The muscles around your joints weaken. Your body, which is designed for movement, slowly stiffens even more. One of the most common times this happens, right after sleep. At night, your body enters a state of deep rest. That's great for healing, but not for your joints. Because as you lie still for hours, fluid in your joints settles. The cartilage doesn't get nourished. And when morning comes, movement feels almost foreign. It's not just aging or sleep that causes stiffness. It's also lifestyle. Sedentary habits, like working at a desk all day, sitting in traffic, or spending hours on the couch, train your body to freeze. Your muscles tighten. Your joints get used to not moving. Over time, what started as occasional stiffness can become chronic discomfort. And here's the emotional truth. Joint stiffness doesn't just affect how you move. It affects how you live. Makes simple things harder. Opening jars, tying shoelaces, climbing stairs, even hugging your loved ones with ease. You might not notice the change overnight, but one day you'll realize that your world has become smaller, Not because you want it to, but because your body is holding you back. I've seen this in people I care about. My own grandfather, a strong man who used to walk everywhere, started avoiding walks because his knees felt tight. He thought it was just old age. But what he didn't know was that avoiding movement was making things worse. So what's the solution? Do we just accept this as part of getting older? Absolutely not. While we can't stop time, we can fight back against stiffness with something simple, accessible, and incredibly powerful. Gentle, regular movement. No, you don't have to run marathons. You don't need to spend hours in a gym. But your joints need to move, to stretch, to circulate fluid, to stay healthy. Try gentle stretches in the morning. Take short walks throughout the day. Stand up and roll your shoulders every hour. Stretch your fingers. Move your ankles. Let your body remember what freedom feels like. If mornings are tough, start slow. Sit on the edge of your bed. Stretch your legs. Rotate your wrists. Breathe deeply and give your joints a few minutes to wake up. If your work keeps you at a desk, set a timer to get up and move every 30 to 60 minutes. Even 2 minutes of walking can make a difference. And if you're already experiencing stiffness, don't ignore it. It's not something to just live with. It's a signal, a call to action. Of course, in some cases, joint stiffness may be a symptom of something deeper, like arthritis, autoimmune disease, or injury. That's why it's important to talk to a doctor if the stiffness persists or gets worse. But in many cases, the first and best step is simply to move. Here's the lesson I've learned. One that's become a quiet mantra for me and for the people I love. Motion is medicine. You don't need to be an athlete. You don't need to be young. You just need to keep moving, gently, consistently, and with intention. Because every step, every stretch, every little act of movement is a message to your body that says, I still care. I still believe. I'm not giving up. So the next time you wake up stiff, don't panic. Don't freeze. Move. Even a little. Because those small movements today might just give you the freedom you need tomorrow. Have you ever wondered what happens inside your body when your knees ache after climbing a flight of stairs? Or when your fingers no longer bend like they used to? What if I told you that deep within your joints, a quiet breakdown might already be in progress? This isn't just about aging. This isn't just wear and tear. What we're talking about is osteoarthritis, or OA, the most common form of arthritis, and one of the leading causes of pain and disability in adults worldwide. And the scariest part, most people don't even realize it's happening until it's already taken a piece of their freedom. Let me take you into the heart of the problem. Inside every healthy joint, there's a miracle of design. Two bones meet, their ends wrapped in a layer of smooth, rubbery cartilage. This cartilage acts like a cushion, absorbing shock, reducing friction, and letting the bones glide past each other with almost no resistance. It's why you can bend your knees, twist your wrists, or wiggle your toes without pain. But in osteoarthritis, that protective cartilage starts to break down. Sometimes it's the result of aging. Other times it begins after an injury, a sports accident, a bad fall, or years of heavy labor that slowly wears away the joint. Either way, over time, the cartilage becomes thin, rough, brittle. And once it's gone, the bones beneath it are left exposed. Now imagine two bare bones rubbing against each other, grinding, clashing every time you move. That's exactly what happens in OA. The body doesn't like this kind of stress. So, it responds. Swelling sets in. The joint becomes inflamed, stiff, and painful. Bone spurs may develop. Movement becomes harder, slower, more painful. I've seen it happen to people I love. My aunt, once a passionate gardener, now struggles just to kneel in her flower beds. My friend, a former marathon runner, had to give up races because his hips screamed with every stride. OA didn't just hurt their joints, it reshaped their lives. But OA doesn't appear overnight. It creeps in slowly, sometimes silently. At first, you might notice stiffness in the morning or after sitting for too long. Then, you begin to avoid certain movements, maybe without realizing it. That knee always acts up when I walk too far. Or, my hands hurt when I open jars. You adjust, you compensate. Until one day you realize the things you used to do without thinking are no longer easy. They're painful. Or worse, they're impossible. And here's where the emotional toll kicks in. Osteoarthritis doesn't just attack your joints. It attacks your confidence, your independence, your sense of control over your own body. It makes you second-guess simple things like taking the stairs, lifting your grandchild, dancing at a wedding. That's why understanding this condition is so important. Because when you understand it, you can fight back. So what can be done? The first step is recognizing the signs. Joint pain, stiffness, swelling, and a decreased range of motion, especially after rest or repetitive use. If you catch it early, you may be able to slow its progression. But ignoring it, or assuming it's just part of getting older, can lead to irreversible damage. While there's no cure yet for osteoarthritis, there are powerful ways to manage it and protect your quality of life. Doctors often start with non-prescription pain relievers, like acetaminophen or anti-inflammatories, to ease symptoms. If the pain persists, they may inject stronger medications directly into the affected joint. But medication is only one part of the puzzle. Physical therapy can make a world of difference. Strengthening the muscles around a joint helps support it, reducing stress and pain. Gentle, low-impact activities like swimming, walking, or cycling can keep you moving without further damaging the joint. Weight management is also crucial. Every extra pound you carry puts additional pressure on weight-bearing joints like your knees and hips. Losing even a small amount of weight can significantly reduce pain and improve mobility. In some cases, when the damage is severe and daily life is deeply affected, surgery may be considered. Procedures like joint replacement can restore movement and relieve pain, but they're usually a last resort after other treatments haven't helped. So what's the takeaway here? Don't wait until the pain is unbearable. Don't let OA steal your life one step at a time. Take action early. Pay attention to your body. Move, stretch, strengthen. And most of all, don't ignore your pain. Because pain is your body's way of asking for help. And when you listen, you gain the power to change the story. Personally, one of the biggest lessons I've learned from both loved ones and health professionals is this. Our bodies are always changing, but we don't have to be powerless. Yes, osteoarthritis is common. Yes, it can be painful. But it's not the end of your story. It's a chapter. And with the right tools, mindset, and support, you can turn the page and keep moving forward. So if you felt that dull, persistent ache, if your joints seem to argue with you each morning, don't brush it off. Don't surrender. Stand up. Take one step. Then another. Your future is still yours to write. What if the pain in your joints wasn't just something to put up with? What if it was your body's way of asking you to make a change before it's too late? Osteoarthritis, or OA, isn't just wear and tear. It's a progressive condition. But here's the good news. You're not helpless. In fact, the way you respond now could define how much of your freedom you hold on to tomorrow. Let me walk you through something I've seen firsthand, both in my loved ones and in my own body. Living with OA is not just about surviving the pain. It's about learning how to move with it, and through it. The first thing most people do when pain hits, they stop moving. Makes sense, right? Your knee hurts, so you stop climbing stairs. Your hip aches, so you sit more. But here's the trap. The less you move, the weaker your muscles get. And weaker muscles mean less support for your joints, which leads to more pain. It's a vicious cycle. So the first step in treating osteoarthritis isn't to stop altogether. It's to be smart about how you move. Start by reducing activities that put direct pressure on your affected joints. If running hurts, try swimming. If kneeling is painful, try stretching in a chair. It's not about giving up movement. It's about changing the way you move. Then comes pain management. Because let's be honest, when your joint feels like it's on fire, no amount of positive thinking helps. That's where over-the-counter medications like acetaminophen or ibuprofen can come in. They won't cure OA, but they can ease pain and reduce inflammation, helping you stay active. But sometimes the pain is more than what pills can touch. In those cases, doctors may recommend injections. These might be corticosteroids, which reduce inflammation, or viscosupplementation, which helps cushion the joint. They're not permanent solutions, but they can buy you time, precious time to strengthen, stretch, and restore function. I'll be honest, there were days I wanted to just rest forever, curl up and not move. But what changed my mindset was physical therapy. Physical therapy isn't just exercise. It's guided, purposeful movement, taught by someone who understands your pain and knows how to help you build strength without causing damage. These therapists don't just focus on the joint. They focus on the whole body. They'll show you how to protect your knees with your hips, or how to align your posture to take stress off your spine. And it works. One of the most surprising game changers in OA treatment. Weight loss. I know it's never easy to talk about, but here's the science. Every extra pound puts 4 times that pressure on your knees. That means losing just 10 pounds can relieve 40 pounds of force from each knee. That's not just a number. That's a real, tangible reduction in pain. But here's something that people often overlook. Don't stop moving completely. Even when you're in pain, even when your instincts tell you to freeze, complete rest is not the answer. Yes, it may feel good in the moment, but long-term immobilization can weaken the surrounding muscles, decrease blood flow, and make the joint even stiffer. You need movement. Gentle, intentional, daily movement. Think of it as lubrication for your joints. Motion is medicine. Now you might be wondering, what if none of this works? What if the pain just keeps getting worse? That's when doctors may bring up the option of surgery, typically joint replacement. But here's the truth. Surgery is the last resort. It's not a decision to rush into. It's a serious operation with real recovery time, and it's only considered when all other treatments have failed and the pain has become unmanageable. And even then, it's not the end. It's a new beginning. Many people who undergo joint replacement go on to live full, active lives again, walking, hiking, even dancing. But the most important treatment of all, your mindset. You have to believe that change is possible. That your pain isn't a punishment, but a signal, a chance to do something differently. To listen, to act, to move. I've met people who were devastated by their diagnosis, and then turned it into a journey of strength, discipline, and healing. They didn't let the pain win. And neither should you. Because at the heart of osteoarthritis treatment isn't just medicine or therapy. It's hope. The belief that your future isn't fixed. That every step you take, no matter how small, is a step toward a better, stronger you. So if you're hurting, if your joints feel stiff or swollen, don't wait. Don't write it off as just age. There's so much you can do. Start small. Start now. Move your body. Talk to your doctor. Trust your strength. Because healing begins the moment you decide not to stand still. What if your body turned against you, without warning, without cause, and without pause? What if every small movement, opening a jar, holding a pen, climbing stairs, became a battleground, not because of injury, but because your own immune system decided your joints were the enemy? That's the painful, invisible reality for people living with rheumatoid arthritis, or RA. RA isn't just an old person's disease. It doesn't just show up in the hands or knees. It's a chronic, systemic autoimmune disorder, and it can strike young adults, middle-aged professionals, even athletes. It's not caused by wear and tear. It's caused by a misfire deep within the immune system, a glitch that makes the body attack its own joint linings over and over again. And the worst part, there's no cure, at least not yet. When I first met someone living with RA, she was only 32. A graphic designer. She loved painting, working with her hands. But then came the stiffness, the swelling, the fatigue that wouldn't go away. Within months, simple tasks felt like climbing a mountain. And still, on the outside, she looked fine. That's the cruel trick of rheumatoid arthritis. It hides behind smiles, behind normal blood work, behind assumptions. But inside, it's a storm of inflammation, slowly destroying the joint's cartilage and bone, and if left untreated, can lead to permanent deformity and disability. But here's what many people don't realize. While we don't yet have a cure, we do have powerful tools to fight back. The most important, DMARDs, or disease-modifying anti-rheumatic drugs. These medications don't just mask symptoms, they slow the progression of the disease. They target the immune system, calming the attack before it can cause irreversible damage. And for many people, they're life-changing. There are different types of DMARDs, conventional ones like methotrexate, and biologics that are more targeted. The key is to start early, because the earlier you begin treatment, the more you can protect your joints and your quality of life. But medication is only one piece of the puzzle. RA demands a full-body strategy. You need to think about how you eat, how you rest, how you move, and how you handle stress, because every part of your lifestyle can either fuel inflammation or fight it. Let's talk about food. Some people with RA find relief when they reduce processed foods, sugar, and refined carbs. Others swear by anti-inflammatory diets rich in omega-3s, leafy greens, berries, and whole grains. While no diet cures RA, nutrition can play a powerful supporting role in managing flares and fatigue. Rest is another hidden weapon. Living with chronic pain is exhausting. But there's a difference between resting to recover and resting to escape. You have to give your body breaks, but not too long. That's why moderate, consistent physical activity is essential. Even on tough days, gentle stretching, yoga, or low-impact cardio can help keep joints mobile and muscles strong. Without movement, joints become stiffer and pain gets worse. So don't wait until you feel perfect, just start where you are. And then there's stress. Mental stress can actually trigger flares in RA. The immune system and nervous system are deeply connected, so learning to manage anxiety, get enough sleep, and create calm routines isn't just nice to have. It's part of your treatment. Living with RA means you have to listen to your body like never before. You have to notice the whispers before they become screams. You have to learn your limits but not let them define you. There will be hard days. Days when your joints feel like they're filled with fire. Days when your fatigue feels like quicksand. But there will also be days of strength. Days when you realize you're still standing, still moving, still creating a life that RA hasn't taken away. One of the most powerful lessons I've learned from people living with rheumatoid arthritis is this. Resilience isn't just about pushing through pain. It's about adapting, finding new ways, fighting smarter. So if you or someone you love is struggling with joint pain, stiffness that lasts more than 30 minutes in the morning, swelling in multiple joints, or unexplained fatigue, it's time to pay attention. RA can be subtle at first, but the earlier you catch it, the more control you have over its future. See a rheumatologist. Questions. Advocate for yourself. Because RA doesn't wait, and neither should you. Living with rheumatoid arthritis is hard, but it's also possible to live well with it, with the right treatment, the right habits, and the right mindset. You are not broken. You are not helpless. You are not alone. And the more we talk about RA, the more awareness we build, the closer we come to a world where no one has to suffer in silence again. So let's talk. Let's move. Let's rise together. One step, one breath, one joint at a time. It only takes a second. Twist, a fall, a sharp misstep, and suddenly everything changes. Whether it's a sprained knee from a weekend basketball game, a shoulder injury from a car accident, or a swollen ankle from a simple misstep on the stairs, joint injuries come without warning. And when they do, they can leave you feeling helpless, frustrated, and even fearful of what comes next. I still remember the first time I experienced a joint injury. It wasn't during anything dramatic, just a quick turn while jogging. A sharp pain shot through my knee, and within minutes, it was swollen and stiff. I couldn't help but panic. Would I walk properly again? Would this mean surgery? Or worse, would it lead to long-term damage? These are questions many of us ask when joint injuries happen. And in that moment of uncertainty, we all search for answers. The good news is, most joint injuries can heal with the right care, patience, and approach. The first, and perhaps the most important step, is rest. Your body is trying to tell you something through that pain. Stop, protect the joint, give it time. Resting the joint means avoiding movements that cause pain or put stress on the injured area. This might sound obvious, but too many people try to walk it off or shake it off. That's not strength, it's risk. Without proper rest, minor injuries can quickly become chronic problems. Next, apply ice. Cold therapy helps reduce swelling and numbs the area, easing pain. It's best to ice the joint in short intervals, about 15 to 20 minutes at a time, several times a day, especially within the first 48 hours of the injury. Then, there are pain relief medications. Over-the-counter non-steroidal anti-inflammatory drugs, like ibuprofen or naproxen, can help manage inflammation and discomfort. But they're not a cure. They're a tool to support healing, not mask it while you push too far. Depending on the severity of the injury, immobilization may be necessary. A brace or splint helps support the joint, keeping it in a safe position while healing takes place. This isn't about making the joint weak. It's about giving it a fighting chance to recover fully. But here's the part many people skip: rehabilitation. Once the initial pain fades and the swelling goes down, many assume they're in the clear. But rushing back into normal activities without proper rehab is a recipe for rain-jury. That's why physical therapy or guided rehabilitation exercises are so essential. These exercises focus on rebuilding strength, flexibility, and stability in the joint. Whether it's gentle range of motion stretches or muscle strengthening routines, rehab helps restore balance to the body and confidence to the mind. I learned this lesson the hard way. I returned to jogging too soon after my knee injury. The result? A longer recovery, more pain, and a lot of frustration. It wasn't until I followed a structured rehab plan that I truly started to heal and move without fear. In some cases, especially when rest, medication, and rehab don't bring enough relief, doctors may recommend a corticosteroid injection directly into the joint. These powerful anti-inflammatory medications can reduce swelling quickly and ease pain when nothing else seems to work. But this step isn't for everyone, and it's usually not the first choice. It's part of a broader strategy, one that's carefully guided by your doctor or physical therapist. Because treating a joint injury isn't just about short-term relief. It's about long-term recovery and preventing future damage. The truth is, joint injuries don't just hurt physically. They affect how you live, how you move, how you see yourself. There's fear, frustration, even shame. But there's also hope. With the right steps, the right care, and the right mindset, recovery is not only possible, it can be empowering. Here's the lesson I've learned, one I want to share with anyone going through this now. Don't ignore the pain. Don't rush the process. Respect your body, and it will heal. So if you've recently injured a joint, take a breath. Take a break. Follow the signs. Rest, ice, medicate if needed, protect the joint, and when the time is right, move again carefully and intentionally. Injuries are setbacks, not full stops. They're part of life, but they don't define who you are or what your body can become. Every step toward healing is a step toward strength. Every small movement regained is a victory. And with patience, support, and commitment, your joints can recover. Your confidence can return. And your journey forward can continue, stronger than ever before. We've all done it. Life gets busy. Pain becomes tolerable. You finish the last of your medication, and when the symptoms come back, you reach into the cabinet for that old prescription. Maybe it helped last time, so why not now? But here's the harsh truth. This shortcut can cost you your health. One of the most common and dangerous mistakes in treating musculoskeletal conditions is self-managing without proper medical follow-up. People often stop going to follow-up appointments, skip physical therapy sessions, or reuse outdated medications. It feels convenient until it isn't. By ignoring the need for regular reevaluation, we miss the golden window. That crucial period when treatment has the best chance of working, when pain can be reversed and function can be restored. Delay too long, and even the most advanced medical options may not be enough. The joint stiffens. The bone deteriorates. The muscles weaken. The damage becomes permanent. And sometimes that damage leads not just to chronic pain but to disability. I've seen it happen. People who were once vibrant, full of life, slowly retreating from the world. Not because they gave up, but because they didn't know how important it was to act early, to act smart, to act consistently. Musculoskeletal disorders aren't just a medical issue. They are a life issue. They affect how you walk, how you work, how you play, how you hug your children or climb the stairs or even sleep through the night. And yet, they often go ignored until it's too late. But it doesn't have to be this way. Let's take a step back. Across this journey, we've explored what musculoskeletal disorders are. Conditions that affect the muscles, bones, joints, and connective tissues. We learned that these problems can come from trauma, like a sports injury or an accident, or they can develop gradually from autoimmune diseases, infections, degeneration, or even a sedentary lifestyle. We talked about joint stiffness, especially how age and inactivity can rob us of movement and joy. We dove into the most common condition, osteoarthritis, where worn-out cartilage causes bones to grind, leading to pain and swelling. And we looked at how to manage it: gentle movement, medications, physical therapy, and, only when necessary, surgery. We touched on rheumatoid arthritis, an autoimmune disease that inflames multiple joints and often requires long-term medication and lifestyle adjustments. We covered joint injuries, how rest, ice, bracing, and rehab can make all the difference. And we emphasized that treatment doesn't stop when the pain stops. It continues with follow-ups, tailored plans, and proactive care. Every single one of these lessons points to one simple, powerful truth. Your body deserves attention, and your health requires action. I've had people tell me, "I thought the pain was just part of getting older," or "I didn't want to bother the doctor again," or even worse, "I was afraid of what they might find." But silence doesn't protect you. Ignoring your symptoms won't make them disappear. Just gives them time to grow stronger. The earlier we intervene, the more we can preserve. Not just movement but independence. Not just strength but identity. Because when you can move freely, when your body works with you instead of against you, you feel more alive. You feel more like yourself. So here's my message to you from the heart. Don't wait. Don't self-medicate. Don't downplay the pain. Listen to your body. Seek help early. Follow your treatment. And never skip the follow-up. There's no shame in needing support. But there is power in choosing it. This isn't just about bones and joints. It's about your future. Your ability to dance at your daughter's wedding, hike with your friends, chase your grandchildren, or simply wake up without pain. It's about freedom. And that freedom is worth fighting for. And to every healthcare provider, caregiver, and family member out there, thank you. Your encouragement, your guidance, your patience, and your presence mean more than words can express. You are the bridge between injury and recovery, between fear and hope. As we end this journey together, I hope you walk away with more than just facts. I hope you carry with you a renewed sense of responsibility and possibility, because healing is not just about treatment. It's about taking charge, making changes, and believing that your health can improve. So if this message spoke to you, or if there's someone in your life who needs to hear it, please share this video. You never know who might be suffering in silence, who might be putting off a doctor's visit, who might think it's too late. It's never too late to care. And if you haven't already, subscribe to our channel, Golden Wellbeing. We're here to support your journey to health, to move with you, grow with you, and lift you up. Together, we can build a future where pain doesn't hold us back. Thank you for being here. Stay safe, stay strong, and remember, your health is your power. Cherish it.